Hi, my name is Monica Palacios. I'm a dentistry graduate from Cuauhtémoc University. Currently, I'm doing my social service at the university, and at the same time, I also work there as a part of the academic team, so my days are usually very busy. In this video, I'm going to show you a little bit about my daily routine looks like, what I do at my job, how I support the students, and what I do during my social service as a dental intern. Honestly, my routine can be a little intense sometimes, but I really enjoy everything I do because it helps me gain experience and grow professionally. So I hope you like it, and let me show you what a typical day in my life looks like. So my day starts at 5:30 in the morning because I live far from the university, and I start work at 7 a.m. so I need time to get ready and pack my lunch. Since I stay there all day, I try to avoid spending money on food. It usually takes me about 45 minutes to get there, sometimes even longer. When I arrive at school, I have to check in with my intern ID, which is basically like logging in so they know I show up. But before my social service, I actually work there. My work schedule is from 7 a.m. to 3 p.m. My office is kind of hidden, so I have to walk across the main courtyard and the dentistry courtyard to get there. And today I even saw a little cat that looked lost. I managed to get it on video. At the time, there's usually no one around because I sometimes arrive a bit earlier than usual. So yeah, I open my office and check it again on a website called Worky. My position is a general assistant in the dentistry department, and my boss is the academic coordinator of the Faculty of Dentistry. My job is mainly to help students with academic issues and sometimes even personal situations as long as they affect their academic performance. For example, I review medical excuses that students send me by email. I have to make sure they are real. I even call clinics sometimes to verify that the doctor exists and has a professional license. Once everything is verified, I approve the excuses so students can turn in assignments or take exams they missed without removing their absence. I also help my boss plan meetings with other departments to figure out what's working, what's not, and how we can improve things so students can do better in their clinics and classes. I keep also records of scholarships, especially for students who are about to start their social service. And this week I also start making charts and list of students who are failing subjects. I also remind my boss about meetings with the director or other coordinators. Honestly, I spend a lot of time working on the computer, and I know it might sound boring, but for me it's not. I really enjoy it because I feel satisfied helping as many students as I can. And it's also teaching me how to work with different departments and help me become more confident. After my work shift, I start my social service here at the school. First, I check with the supervisor on duty, and she tells me what my role will be that day. Most of the time, I'm assigned to deliver forms to the 8 different clinical labs at the university. These are documents students need to treat patients, like informed consent forms, treatment sheets, and post-operative instruction for patients who had a surgery. There is one of the 8 clinicals that the university have. Before I got hired as an assistant, I used to spend my mornings as an intern in a mobile dental unit where we travel to different communities in Querétaro. We provide clinics and gave educational talks. In the afternoons, I worked with a dentist at her clinic from 4 to 8 p.m. There I treated patients and helped keep the clinic organized by managing inventory and scheduling appointments. In this video, I'm showing some of the work I used to do at the clinic. It's a bone surgery and you can see me suturing. So yeah, that's a little bit about my daily life looks like. Even though my days can be very busy and sometimes a bit exhausting, I truly enjoy everything I do. I know I'm still in the process of growing as a professional, but every experience I gain brings me one step closer to becoming the dentist I want to be. Thank you for watching. I hope you enjoyed learning a little more about my routine.
Baila, baila, baila. Sí, muchas gracias. Hi, my name is Diana Ceciliano and today I'm going to show you what I do on a typical week as dental student in my work and the clinics. First, the clinics are divided by specialty and based on what the patient needs. This time I was in the endodontics clinic. To start with, it's very important to put on protective gear before treating a patient, which includes a lab coat, a cap, a face mask, and gloves. The patient came to the clinic because he had been experiencing severe throbbing pain for about 3 days. After taking his medical history to make our diagnosis, we found that he had irreversible pulpitis caused by deep caries, so we began endodontic treatment on the upper central incisor. We followed the full protocol for absolute insulation, which is what you see in the blue, then covering the entire mouth and teeth, except for the tooth being treated. Here the patient was already fully anesthetized in the upper region, so they wouldn't feel any pain. Lighting is very important here. The dental chair lamp must be directed on the tooth so we have good visibility. Always remember to take an X-ray to verify the work is progressing well. The root canal treatment is complete by placing filling material to replace the removed pulp, and the patient is referred in the next clinic to restart the tooth with a resin. Well, just move to on the next clinic, which specializes in the oral rehabilitations. In this case, the patient had a tooth extracted and need to replace on missing teeth with a removable denture. Here I'm preparing the site for the denture. I'm using a floss pack to create a space between the tooth and the gum so that the denture can be placed in the space and fit perfectly. To ensure that the patient is satisfied with her dental prosthesis, I will place a temporary prosthesis that mimics the final one. This will help me verify that the bite is correct, the fit is good, and tooth color is right. After finish with the patient, I move to dental lab work. Here, after seeing patient for oral rehabilitation, we are take dental impression using alginate, a special material used to replace all the structures so we can create dental prosthetics. Here I'm using the trimming machine which help me cut the model so they are we defined against the anatomical structure, allowing us to make the patient's dentures. Once the model are ready, the next step is to send them to the laboratory. In this case, a patient removed denture and full denture were fabricated. These are made by replacing the missing teeth with acrylic teeth and metal frameworks that fit the patient soft tissues. And in the lab, we also see the digital aspect. We have a patient case where does not need to use uncomfortable materials like alginate. There's a program that scans the patient teeth which is more comfortable for both them and used because we can see the patient structures in full detail. We can make adjustments. I'm doing here more quickly and efficiently, and patient even feel less anxious. And I like this part of the job because I can be done more quickly and I can make all the necessary changes. I'm satisfied. And finally, I went to maxillofacial surgery clinic. This patient came as emergency for a tooth extraction, so I didn't take many videos just for the sterile surgical supplies ready for the molar extraction to surgery paint. And that was it. Thank you very much.
Hello! Today I will explain a day at the work. When we arrive, we clean our the work are and start with preparing everything for arrival of the patient. We receive our patient Frida and accommodate them in the unit. We put on our protective barriers and we place a film on the patient to prevent it as leaked from explain of the hearing. We will the try to have during position with the intraoral mirror which check the patient and this time we will place fluoride on a glass. With the intraoral mirror we check the patient and this time we will place fluoride on the glass. Tilden and white eye macros we place organs which had also having the openings of cavities and avoid sensibility for two patients. We explain to the patient the instruction for following after applying the fluoride and the care she should take, such as not eating for an hour or eating any food. With the patient lives, we clean up our work art and wash off the material and our hands, clean the dental unit and close the office's wheels. Thanks you so much. This was and I on the work with me learning about the importance of fluid in the oral cavity.